am Chandra Van Dyke McGee, and I serve as the Director of Special Initiatives for Habilitative Systems Incorporated.
Oki Nistunitanaku Miyaki. Hello, everyone. My name is Lynn Madplume, and I am the Executive Director of Two Powers Land Collective. We're a 501c3 nonprofit that provides equine assisted services in the Blackfeet Nation.
My name is Ann Ringstad. I'm the Executive Director for NAMI Alaska. We service the entire state of Alaska under the umbrella of the National Alliance on Mental Illness, the nation's largest grassroots mental health advocacy organization.
Hi, I'm Marcia Sledge. I'm the Interim Executive Director of Mental Health America in Montgomery.
My name is Raina Lett, and I am the National Support Services Director with the Hidden Genius Project.
Yes, hello, good afternoon. My name is Patricia Kerr, and I am the founder and organizer of I Am a Better Me. That's a wellness organization that's working here in the community to help people with their mental health.
My name is Dr. Tasha Jordan. I am a psychiatrist, and I'm also the founder and executive director of the Christian Mental Health Initiative. The Christian Mental Health Initiative, also called CMHI, was started in 2022, really to meet the need of the church, where I saw really that a lot of churches were becoming more aware of the need to address mental health challenges within the church. But most church leaders, pastors, deacons, ministry leaders really didn't have the training to address that need. So CMHI really fills that gap to bring education, resources, referral pipelines, programming to the church to be able to help really bridge that gap of mental health and faith, specifically from a Christian context.
Hi, my name is Sherry. I'm the Executive Director of Ahana Makamai in Hana in Maui. We are in a rural community, and we are the only ones that do mental health, substance abuse, domestic violence, and food bank.
So super excited about the opportunity to engage people who have typically been underserved to resources and opportunities to ensure that they're connected to care and know that the access is there if they're in need of resources. The project we'll be undertaking with the More Equity Grant is to expand our trauma-informed outreach and engagements to connect individuals facing barriers to culturally responsive mental health care. This work addresses mental health inequities by strengthening access to trust and connections to care in communities that have historically been underserved.
The APA More Equity Grant is helping fund our White Rider Healing Ranch, and that is the ranch where we provide equine-assisted mental health services for free of charge to community members, where we help with unresolved grief, trauma, really any of the things that our communities are facing. There's really not a lot of mental health resources, and so what we do is culturally grounded, and we work with horses. Yeah, so in Blackfeet culture, horses are central to who we are. We were always known as people of the horse. And this work was really guided by my brother, who we lost to suicide. He had a love for horses and he wanted to share that with the world. But unfortunately, the work couldn't meet him before we lost him. And so this work is really in honor of him. His traditional name is White Rider Healing Ranch. And that's why we provide free mental health services to our community. It's in honor of Wyatt Madplume.
We are focusing on the North Slope of Alaska, which is at the very top of the state. And we have a small affiliate up there under our umbrella where we work with the leaders of the community to understand what their needs are as far as behavioral health supports and try to offer them something if we can for what NAMI Alaska can offer them. Because it is so far away, it's a 2-hour plane ride. There are no roads to it. You can't drive a snow machine to it. It's way up at the top of the state. They live in harsh conditions, very little mental health support up there. And we would like to bring our Ending the Silence program. Well, let me back up. We are meeting with them. We have met with them, and we're going to continue meeting with the community leaders and the residents, asking them what kind of supports they do have up there. And secondly, after we listen and consider it, then we would offer them things like Ending the Silence, which is a web-based program for middle and high school students to talk about mental health. It's produced by NAMI National. It's evidence-based, and there are a number of video vignettes that are done by students talking about their mental health illness, talking about what they went through, and then the good end of the story of what they're doing now. We also are working with the Indian Health Service up in North Slope, along with the Department of Behavioral Health and many other organizations, including the school district, to understand what students may need in order to thrive. Not the North Slope area holds the distinction of having the #1 suicide rate for youth in the nation. They don't want that to be anymore. They want to do something about it, and they're banding together as a group to try to figure out what do we do next, not only for Uktiavik, it's known as Barrow, but they call it Uktiavik, and the surrounding villages. How can they help their youth in order to understand more about mental health, more about the trauma that they have experienced in their family and themselves, historical trauma, and giving them some tools to use to move forward in a positive direction.
Yes, we are so excited to be a recipient of the More Equity Grant. With this grant, we will partner with middle schools to reach young men of color. Through this collaboration, we will facilitate workshops focused on emotional well-being, coping strategies, self-regulation, and communication. I will also focus on skills tailored to the unique needs of adolescent males. By embedding these workshops into the school curriculum, we will aim to create a positive, more safe environment for these adolescents.
The Hidden Genius Project's Mindful Genius Initiative will empower Black male high school students to build resilience, self-awareness, and healthy coping strategies through monthly wellness workshops led by culturally competent clinicians and mentors. By providing a safe, affirming space, the program will directly address rising mental health challenges such as stress, grief, and the effects of racism, while reducing the stigma and promoting equity in care of our Black male youth. Over the 2 years, participants will gain effective coping strategies, strengthening their mental health literacy, practicing sustainable self-care, and fostering a deep sense of belonging and equipping them to thrive academically, personally, and as emerging leaders in our community.
So right now, I'm proud to be part of your network with the American Psychiatric Association, where we will be addressing the young people from 12 to 24 with their mental health issues. So we will be, conducting community outreach, some workshops, and some training, leadership development, and so on and so forth. Right now, I'm trying to engage with the Board of Education so that I could have access to the school. And also, I have reached out to the Bronx Community Justice Center, their youth division program, so that we can make this as rich as possible. Thank you for the opportunity to work with your organization.
So the project that we'll be working on with the More Equity Grant, we're really excited, to be honest, to roll out with one of our partner churches here in Philadelphia, the Block Church. We are working with them to roll out mental health response teams. And we're specifically working within young adult populations. So the Block Church, particularly their Center City, Philadelphia location, really serves a community of recent high school graduates, college students, graduate students, and young professionals. And specifically at this church location, leadership has come to us in the past and really mentioned specific challenges that have come up that they really struggle to address, whether it's people expressing suicidal thoughts, having active symptoms of psychosis in service or Bible study or other events at the church. So what we were able to do is to come up with this idea in partnership with leadership at the church to really bring teams to the block where members can serve as really as a response team. They're not giving professional help by any means, but what they really will be doing through this project is being able to compassionately respond with care and also with guidance that's clinically sound in terms of sending them to the right places for care. And it's really important that this is going to be something that is driven by the youth, the young adults at the church, the young adult leadership at the church, and integrated into systems that already exist, which is something called the block group, which is basically like a Bible study, small group, life group. There are different names that churches may have for it, but using that block group context to develop the mental health response teams, to get folks in the church trained in mental health first aid, and really have a systematic way to respond to challenges that come up in the church, because they do happen, and we want to make sure that we can support the church in responding in a way that'll get people help as soon as possible. One thing I'm really excited to share is that we already are getting the ball rolling. We have our first mental health first aid training scheduled for later this month. And we really just look forward to continuing to establish this programming within the church, utilize the funds from the More Equity grant, which we're really excited to receive, and really be able to show on the back end of this fellowship and the grant process what we have been able to achieve by supporting the members and visitors of the Block Church in Philadelphia.
Olahahi Okami, which means one person in Hawaii, and it's mental health counseling for Kapuna and Kiki, which is the seniors and the children. And we're going to offer one-on-one counseling as well as workshops. We sent out a survey before we got the grant asking what they would like, and the Kapuna said they would like to talk story, as they say, and that's just basically everybody getting together and discussing what issues that they have. So we're going to do a group as well as the individual, but it will be more structured than just a group counseling session.